Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. When we come back, we'll be discussing how you can effectively eliminate headaches with the Washington, D.C. area's top doctor of chiropractic, Dr. Jay Greenstein. Dr. Greenstein received a postgraduate degree in sports chiropractic from the Logan College of Chiropractic, served as an associate to the official 1988 Olympic team doctor of chiropractic, and became the director of research for the American Chiropractic Association's Council on Sports Injuries and Physical Fitness. He, along with his organization, Sport and Spine Rehab, has also been a recommended provider for the National Football League Players Association and has been the official chiropractic provider for the Washington Redskins cheerleaders. Welcome, Dr. Greenstein.
Thanks, Rocco. Good to be here.
Oh, it's our pleasure to have you back on with us. We've got so much to talk about regarding a problem that so many of us suffer from, headaches. And with that being said, however, if you can please begin by telling us what chiropractic care is and the types of issues it addresses, I would greatly appreciate it.
Chiropractic care in its purest sense really is a hands-on, drug-free approach to restoring normal biomechanics to the spine and extremities. We address a variety of neuromusculoskeletal conditions, everything from neck and back pain to carpal tunnel syndrome to headaches, shoulder and knee pain, ankle pain, you name it. If it's muscles, joints, or tendons, we're dealing with it.
Can you please tell us what sets your organization, Sport and Spine Rehab, apart from the others?
What sets us apart is our treatment philosophy. According to the scientific literature, the combination of chiropractic, physical therapy, and rehab typically have the best outcomes for patients. So what we do is we combine chiropractic, spinal manipulation, physical therapy, and rehab in order to get the best outcomes for our patients. Chiropractic manipulation, exercise protocols through rehab, soft tissue techniques are all tools in a toolbox that we use to get the best outcome for whatever patients are suffering from.
I understand that this type of care is effective treatment for other types of issues, for instance, headaches?
Absolutely. We see a lot of headache patients in our practice. 90 to 95% of people will suffer at least one headache throughout the year. In addition, the costs that have been estimated for this particular problem are upwards of $50 billion. There's lost productivity at work, there's absenteeism at work, and it's a huge problem which needs to be addressed. And we can do that very, very well in our practices.
Well, on that note, let me ask you, Dr. Greenstein, what types of headaches do you treat?
The most common type of headache that we do treat in our practice is cervicogenic headache. Cervico meaning neck, genic meaning origin. So basically the pain is coming from dysfunctional joints and or dysfunctional muscles and or pinched or compressed nerves in the neck. That's the most common type of headache that we treat.
Isn't there medication available for the treatment of headaches?
Rocco, let me be very, very clear about this. I am not opposed to medication for patients who suffer from a variety of conditions. However, medications alone should not be the only source of treatment for these patients. Again, in these types of patients, dysfunctional joints that have biomechanical issues and or dysfunctional muscles which have biomechanical issues and or nerves that are being compressed because muscles are very, very tight are the predominant cause of these types of headaches. You can medicate the patient, however, that's not going to fix the cause of the problem.
We're now going to see the treatment of a patient with headache issues.
There are multiple muscles in the neck that can cause headaches, cervicogenic headaches. The upper traps, the scalenes, the sternocleidomastoid are a few, and doing an active release on those muscles assists in resolving that condition. In addition, cervical traction is important in helping to loosen up joints and relax muscles. And suboccipital release can help to relax muscles that cause headaches, called suboccipital headaches. A lot of times that pain in the back of the neck is a result of these.
We're now back with Dr. Greenstein. That was very interesting.
We like to make our treatment plan as comprehensive as possible, addressing all the areas and all the tissues that could potentially be causing pain or dysfunction for these patients. Ultimately, the goal is to restore 100% normal function so the patients not only feel better, but they stay better, and that's the key.
Do patients need a referral from their doctor to visit a specialist like yourself?
Although most of our patients do come from primary care physicians, not all patients require a referral. We do accept all major insurance carriers, and what we do for our patients is we verify their benefits ahead of time. time. When they make the initial phone call, we get all their information, we verify their benefits, and then we let them know ahead of time what their benefits are.
We're now going to meet Lisa, who's a patient of Sport and Spine Rehab. Welcome, Lisa.
Thank you.
Oh, it's our pleasure to have you on today as our guest. And let me just begin by asking you, what type of headaches did you suffer from?
I had tension and stress-related headaches that really were centered in the back of my neck, extending up through my eyes, and then down through my right shoulder also.
Sound rather extensive.
Yes, it came from, I think, overuse. I'm a graduate student, and I work a lot at the computer, take a lot of notes.
Now, how did they affect you as far as what you were trying to do in day-to-day life and the pain that you obviously suffered as a result of these headaches?
It became very debilitating. There were many times during classes when I would just have to put my hand down. I couldn't take notes anymore. I drove almost entirely with my left hand at one point.
Let me ask you, Lisa, what types of treatments did you receive?
At first I came in 3 times a week to see both the chiropractor and a physical therapist and to do the exercises here. On the off days, I would do exercises and stretches at home also. There's immediate relief that comes as when you visit the doctor, but it comes back because this is a chronic pain and it takes a lot of time to really fully deal with it. So after several months, I would come twice a week, then once a week, and after I'd say 6 months, it was once a month for maintenance. And I think the maintenance is really important because now it's probably 1.5 years after I first started treatment, and I have been headache-free for at least 6 months.
Well, I'm very happy to hear that, Lisa. You certainly sound a lot better because you feel a lot better than you did prior to these treatments.
Absolutely.
And on that note, I'd like to thank you for being a guest today and joining us on A New Me.
Happy to be here.
Our pleasure. We're now back with Dr. Greenstein. I must say, Lisa seemed very pleased with the results, and to hear that she's pain-free now, that's wonderful news.
She had an excellent outcome, and although she required longer-term care, many of our patients respond much faster.
Can you please describe the typical patient that would come to a clinic such as yours?
Any patient who has neuromusculoskeletal conditions or symptoms or problems can respond very, very well to our treatment. We really are looking to help those patients that are highly motivated and want to play an active role in their care.
Are patients generally cured if they finish their course of treatment?
Most of our patients have a very, very good outcome, and I don't necessarily like to use the word cured. Their function is vastly improved, if not maximized. However, there are patients that are not necessarily cured, but are feeling much, much better, and their function is much, much better, and they're able to perform their activities to a much greater degree with much less discomfort than before.
And I have to ask you this, Dr. Greenstein, how safe are these treatments?
These treatments are extremely safe. They may be, in fact, safer than some of the side effects that occur with long-term or even short-term use of medications.
Well, that's certainly very good to know. Now, we've only got a few moments left, Dr. Greenstein, and I have to ask you if there are any final thoughts that you'd like to share with all of us.
Rocco, our mainstream conservative approach has been supported by many, many articles in the scientific literature. I think it says a lot that physicians throughout the DC metro area refer patients to all of our practices. Patients with headaches are being mismanaged, and what we want to make sure is that they're not just medicating their condition, they're not just covering up their symptoms. We need to identify the problem, we need to fix the problem, and we need to make sure the problem doesn't come back, and that's our goal. So we want our patients to be able to work better, play harder.
Well, on that note, I certainly want to thank you, Dr. Greenstein, for joining us today. I would definitely say it was very helpful and informative, and certainly lets us know of some other options that are out there for all of us.